Thank you all for joining us today. I'm Rachel Ross, Director of Grants and Programs at the Foundation for Financial Planning. I wanted to let everyone know that this webinar is being recorded to allow for future viewing. During these difficult times, financial planning and advice for pro bono clients is more important than ever to provide additional resources and knowledge to nonprofit leaders and financial planners engaging in this work. FFP is hosting a series of webinars. I'd like to welcome John Dauphiné, CEO of FFP, to kick off this webinar on public benefits and other social services. Thank you.
Great, thank you, Rachel. And I just want to thank all of our attendees and welcome everyone today. As Rachel mentioned, this is part of a series of webinars that we're doing to try to bring educational content to pro bono financial advisors, to grantees, and it's all about making sure that we can have an impact in these turbulent times. And so we very much appreciate, I know we have a lot of representatives of our grantees, including especially Family Reach, and then also a lot of CFP volunteers viewing today. As Rachel mentioned, we are trying to deliver as many informational resources as possible. On our website, we have a resource center on COVID-19, and you can go to that. It's at ffpprobono.org/coronavirus-resources. We're curating that, we're updating that on a daily basis. So I think you'll find a lot of helpful things there, including a guide on the latest provisions in emergency legislation that can help pro bono clients. We are also doing some emergency grants to help our current grantees go to virtual service delivery and to add some new grantees who are serving vulnerable populations virtually, as well as developing some new programs for those who are most affected by the economic fallout of COVID-19. You may have also seen we have launched a matching platform. So if you're a certified financial planner who would like to volunteer, I encourage you to go to cfpvolunteermatch.org, where you can register and browse opportunities, and we'll be adding more and more opportunities as the national response to COVID develops. So hopefully you'll find that to be a good resource. And then finally, just recently, we launched our COVID-19 Financial Resilience Fund. And this is really to power the work that we're doing to help vulnerable people in the wake of the pandemic. And I'm really pleased to say we have a dollar-for-dollar match going on right now, sponsored by Charles Schwab Foundation. So that will enable a doubling of contributions at this time period. So I mentioned vulnerable folks, and of course, people with cancer have been identified as particularly at risk during the pandemic for the health issues they're facing, but also the very serious financial issues that many grapple with. And so many of you know we've had our Pro Bono for Cancer campaign going for a number of years now, and we have two incredibly valuable partners, Family Reach, which is our national partner in this effort, and the Financial Planning Association, which has contributed so many volunteers to the effort and also a lot of great thought partnership. Family Reach is all about helping average families with what is called the financial toxicity of cancer. About 1/3 of folks with a serious cancer diagnosis deplete all their savings, and about 1/4 have to raid their retirement funds. And that's before the advent of this pandemic. So as one can imagine, it is a very, very dire time, and we are committed to growing this program and continuing this robust partnership. In fact, by the end of this year, we are hoping to bring services to more than 1,200 families overall. Today we have a special guest, Jackie Lake, who comes to us from Family Reach, and Jackie will be talking about public benefits and other social services. that are particularly important during this time of crisis. Jackie has a master's of social work from Rutgers University, and she is Family Reach's senior manager for program innovation, and really has some great tips and information today. Jackie works with patients and oncological care teams at the Family Reach 400 or so hospital partners, and she's involved in many different aspects of Family Reach's mission to bring financial assistance, planning, and relief to cancer patients and their families. So very pleased to have Jackie. There'll be time for questions at the end, and I want to now turn it over to you, Jackie.
Thanks so much, John. Hi, everyone, and thank you for joining us today. I'm really excited to be here to share some of my experience and knowledge with you all. I'm going to go ahead and switch off from video cam and instead show the presentation. So give me just a second here, and we're going to go ahead and get into it. Let's see. Okay. All right, and maybe John, could you just jump in and make sure, I just want to make sure everyone can see the screen.
Can't see it right now. We did see it before though, Jackie.
Is it on a blank slide?
It is not, so give me just a sec. I just want to see what's going on here. Sorry about that.
We can see it now, Jackie.
Okay,
Yeah.
Great, perfect. Okay,
Right.
Sorry about that. So thanks again, everyone, for joining us today. I want to start also just by expressing my gratitude to the Foundation for Financial Planning and the Financial Planning Association for recognizing the need to better understand these public benefits that are available to lower income clients, and for hosting this webinar to address what is quickly becoming a relevant discussion this day and age. Before we begin, I want to note that we did reserve, as John mentioned, some time at the end of the presentation for questions. So as we go along, feel free to enter your questions into the chat box of GoToMeeting, and we'll do our best to answer as many as possible. I can't promise that we'll get to everyone's questions, but I'm happy to also share my contact information at the end of this presentation. And anyone who is curious about more or has a specific situation that they want to talk through is welcome to reach out to me directly. So as John mentioned, my name is Jackie Lake, and I'm the Senior Manager of Programs Innovation at Family Reach. Family Reach is a national organization dedicated to eradicating the financial barriers that often accompany a cancer diagnosis. We work with patients and their healthcare providers across the country to offer our solutions-oriented approach, which we call the Financial Treatment Program. This innovative, holistic approach to a patient's finances consists of financial education, personalized navigation to supportive programs, including those that we'll talk about today, pro bono financial planning services, and financial assistance to those who qualify. At the end of this presentation, I'll provide you all with some helpful links, including how to volunteer your planning services to Family Reach Family, as well as links to our financial guidebook for cancer patients and our COVID-19 policy website. As for me, like John mentioned, I'm a licensed social worker out of the state of New Jersey, and I've been working with Family Reach for the past 5.5 years. In this time, I've had the opportunity to work with hundreds of patients and their caregivers to address the devastation that cancer can have on a family's finances. And along the way, I found it was vital to understand the government benefits that patients, especially those who are lower income or expecting to lose a large portion of their income, can access. So I'm really excited to be here today to share some of what I learned with you all so that you can feel more comfortable in your work with lower income clients. Hopefully, at the conclusion of today's webinar, you'll have a higher level understanding of the entitlement and welfare programs available to assist lower income clients. You'll have an increased understanding of the eligibility criteria for those programs and an increased understanding of how to direct clients to apply for those programs. To demonstrate the real-life application of the programs we're going to discuss today, I wanted to start this presentation with a story that is typical for a family fighting cancer and the type of patient we serve every day at Family Reach. So April is a 36-year-old single mother of 2 children, and she recently started a new job as an art teacher at a public high school. Shortly after the school year began, April received a devastating diagnosis of stage 3 colon cancer. She's scheduled to have surgery next week, followed by monthly chemotherapy treatments. April and her doctor anticipate that once treatment begins, she'll be out of work for the next 18 months, and that could change. It could be longer. April calls Family Reach and shares her financial concerns with us. Without her income, she doesn't know how she's going to manage rent, food costs, childcare, and her regular monthly bills. So I just ask that we all keep April and her story in mind as we learn more about the programs that could be available to help her and her family. Well, the first thing April might be thinking about is whether or not she qualifies for one of the 2 disability programs offered through the Social Security Administration. These programs are Social Security Disability Insurance and Supplemental Security Income. In order to qualify for either of these programs, a person must meet the following criteria. 1, they must have a condition that meets the SSA's definition of a disability. And 2, they have to be expected to be out of work for a period of a year or more, or have a condition that's expected to result in death. Detailed information on what conditions do and do not meet the SSA definition of a disability can be found online in what's known as the SSA Blue Book. I'm going to link that at the end of this presentation so that way it's easily accessible for you if you're ever working with somebody who does have a disability. I also want to note that people applying for disability will be asked to provide detailed information about their work history and medical condition. Past employers and medical professionals may be contacted as a part of the disability application in order to verify that a person cannot perform their job and cannot adjust to a new job due to their condition. Next, I'm going to go into highlighting some of the distinctions between Social Security disability insurance and supplemental security income. Beginning with Social Security disability insurance, or SSDI. SSDI pays benefits to people with disabilities and their loved ones if the disabled person has worked long enough and paid into the Social Security tax. If it's a child that has a disability and the disability begins before the age of 22, they may be eligible for benefits based on their parents' work history and earnings records. SSDI is an entitlement program, meaning that anyone who has paid into SSDI is eligible to receive these benefits so long as they've worked enough and are deemed to be disabled by the Social Security Administration. But one key eligibility feature of SSDI is that a person must have earned enough work credits to receive their benefits. Work credits are based on your total yearly wages or self-employment income. A few details about work credits. Everyone can earn up to 4 work credits per year, and the amount needed to earn one single work credit changes from year to year. So in 2020, for example, you earn 1 credit for each $1,410 in wages. In other words, once you've earned $5,640 in wages, you've earned your 4 work credits. This chart, which is provided by the SSA, demonstrates the number of work credits needed for a person to receive Social Security disability benefits. So if we think back to April, our 36-year-old teacher, we'll see that she would have needed 20 work credits or have worked at least 5 of the last 10 years in order to qualify for Social Security disability. There are, excuse me, there are some other considerations for SSDI that I do want to highlight. Number one, if you're working in 2020 and your earnings average more than $1,260 a month, you generally will not be considered disabled. Another important thing to highlight and keep in mind as you're working with clients is that SSDI claims can take 3 to 5 months and often longer to process. A person doesn't begin to receive their benefits until 6 full months after the date of disability onset, which is determined by the SSA. So that's the date that the SSA determines you were no longer able to work. The SSA does have an expedited process through their Compassionate Allowance Program, which is determined based on the severity of the applicant's condition. A list of those conditions that meet the Compassionate Allowance criteria will also be linked at the end of this presentation. Something else to keep in mind is that many disability claims are denied the first time around, either because the condition was not deemed severe enough or because the applicant's income and work history prevented them from being approved. So if you're working with a client who was denied SSDI, they can appeal this decision, but they have to do so within 60 days of the claim denial. Benefits are determined based on the applicant's average lifetime earnings. So a person who has a higher average lifetime earning will receive a higher benefit than somebody who has a lower average lifetime earning. I'll call your attention now to the bottom of the slide where I have a link to apply for SSDI. And so wherever possible during this discussion, I'll link the direct application. For state-specific programs, the link that's going to be provided in the presentation will bring you to a state-by-state directory of applications so that you can provide the most accurate information to your clients across the country. The other federal disability program is Supplemental Security Income, or SSI. SSI is a means-tested program, meaning it's only available to those who meet income and resource eligibility. For those that do qualify for SSI, it'll help provide cash to meet basic needs for food, clothing, and shelter. The measures for income and resources through SSA can be rather nuanced. For example, resources will include personal property, but can exclude one vehicle if you're using that vehicle to go to work, or your wedding or engagement ring as an example. So with only an hour today, we're not going to have time to get into all of the specifics about what counts as resource and income, but as a general rule, income includes money you earn from work and money you receive from other sources such as Social Security benefits, workers' comp, unemployment, VA benefits, money that you're getting from friends or relatives, and anything that goes towards free food or shelter. Resources include cash, bank accounts, stocks, savings bonds, land, vehicles, personal property, and anything else that a person owns that could be converted to cash and used for food and shelter. Keep in mind, though, that resource list does have some exclusions. Once again, I've provided the full list of those at the end of the presentation, but it really is just too nuanced to get into the nitty-gritties here today. In order to qualify for SSI, an individual cannot have more than $2,000 in resources, and a couple is not eligible if they have resources exceeding $3,000 in value. So you'll see automatically it's a pretty strict resource limit that somebody needs to meet in order to be eligible for this program. But for those who are eligible, the 2020 federal benefit rate, so the maximum payment you can receive, is $783 for an individual and $1,175 for an individual with an eligible spouse. So if we think back to April, we don't know enough about her income or resources to be able to determine if she qualifies for SSI, but assuming she has earned enough work credits, she should be able to receive Social Security disability insurance since her condition will leave her unable to work for a period of 18 months or more. I also just want to note that it is possible for a person to receive both SSDI and SSI. And this occurs when a person's SSDI, which remember is the benefits are based on your average lifetime earnings. So if those benefits are so low that it still brings you into the eligibility criteria for SSI, you can receive both payments, but likely wouldn't receive SSI in full. Moving on to from disability to another really important program, and I'm sure one that has we've all read about a lot in the news lately, and may even know some folks in our lives who are applying for this program or trying to apply currently, unemployment insurance. Unemployment is a joint state and federal program that provides cash benefits to eligible workers. Each state administers a separate unemployment insurance program, and that means they're able to set their own eligibility requirements for wages earned or time worked. Usually, a person will qualify for unemployment if they're unemployed through no fault of their own. So typically that means if you've been separated from your last job due to a lack of available work, and if they meet the work and wage requirements set by the state, but also could be stricter set by the federal government, but could be stricter or more generous depending on the state in which you live. And they could also have to meet any additional state requirements, such as proving that they're looking for different work opportunities. Typically, unemployment insurance lasts up to 26 weeks, and workers could be eligible for a 13 to 20 week extension if they don't find work within that period. The amount of money that a person will receive from unemployment insurance depends on their previous income. So in response to the COVID-19 pandemic, the Families First Act and the CARES Act allowed for states to expand their eligibility criteria, as well as increase the benefit of unemployment insurance. So temporarily, we'll find that states are covering far more people than usual, including self-employed workers, gig workers, freelancers, part-time workers, and even people who are still employed but are not being paid due to being furloughed or being quarantined. Additionally, the Families First Act allowed for all unemployed workers to receive an extra $600 a week for up to 6 months. Those unemployed workers are also eligible for an extra 13 weeks of benefits beyond the number their state currently provides. So let's think it back to April. Remember, she was a school teacher. So suppose as a result of COVID, April's school temporarily closes and she's not able to work. April can now apply for unemployment insurance, but she'll want to consider how receiving these wages would impact her SSDI application, since she can't earn more than $1,260 a month to qualify for Social Security disability. So I give that example because I think it really shows just how difficult it can be for patients to navigate these circumstances when they are needing income to pay their monthly bills immediately, and knowing that Social Security disability, remember, takes 3 to 5 months to process. It can be a really difficult decision for many to move forward with a disability application because they, again, cannot earn more than $1,260 and be considered disabled. So moving right along, the next program we're going to discuss is called Temporary Assistance for Needy Families, or TANF. TANF provides grants to states and territories, and in turn, those states are able to provide families with financial assistance and related supportive services. State-administered programs can include things like child care assistance, job preparation, and work assistance, as well as direct financial assistance. In order to qualify for TANF benefits, the applicant must be either pregnant or responsible for a child under 18, be a U.S. national, legal alien, or permanent resident, have a low or very low income. They must be underemployed, unemployed, or about to be unemployed. In addition to that eligibility criteria, each state and territory also establishes their own criteria that must be met in order to receive any type of financial assistance payment or other types of benefits and services. So just as states can set their own eligibility criteria for this program, they also have the flexibility to set their own benefit levels. In general, I would say that TANF benefits are usually pretty low and they don't usually enable families to meet their basic needs. In response to the COVID-19 pandemic, the states do have the flexibility to further expand their services and broaden their eligibility criteria. And one particularly useful option that they're able to employ during this time is what's called the non-recurrent short-term benefit. So this helps, again, to expand the eligibility of who can qualify for TANF. This is a specific piece of rule within TANF that is designed to deal with a specific crisis. It's not intended to meet recurrent or ongoing needs, so it's really just for a short period of time that we are in this pandemic. And NRST, the expansion of those benefits will not exceed 4 months. So the link under here to apply will bring you to a state directory of how to apply for TANF for that particular state. And I guess I should just mention these slides, I know Rachel mentioned, are being recorded, but they will also be available so that you're able to go in and click through on the programs as needed and the applications. So in addition to those income replacement programs, there's also public benefits that address specific needs like housing, utility, and food costs. The first of these programs we'll discuss is the Housing Choice Voucher Program, or more commonly known as Section 8. Section 8 assists low-income families, the elderly, and the disabled to afford housing in the private market. Housing Choice Vouchers are funded through the U.S. Department of Housing and Urban Development, or HUD, and administered by public housing agencies, PHAs. With Section 8, housing assistance is provided on behalf of the family or individual, and then participants are able to locate their own housing, including single-family homes, townhouses, and apartments. The housing subsidy is paid to the landlord directly by the local public housing agency, and if the amount that the family's been approved for does not meet the full rent, the family is then responsible for the difference of the payment between the actual rent charged by the landlord and the amount subsidized by the program. So eligibility for Section 8 housing is determined by each local PHA based on the total annual gross income and family size. In general, the family's income cannot exceed 50% of the median income for the county or metropolitan area in which they choose to live. And a list of the median incomes is accessible by reaching out to that local public housing agency. They'll be able to tell you, exactly what the threshold is for a family to qualify for Section 8 housing. Something to keep in mind about Section 8 is that it can take a very, very, very long time for an eligible person to receive this benefit. Many public housing agencies have long wait lists, and at times that list can become so long that they close completely. So while this program is tremendously helpful for many people, it's also tremendously difficult to get into. In response to COVID, the CARES Act did impose a 120-day temporary moratorium on evictions, as well as a moratorium on fees and penalties related to the non-payment of rent. So folks have a little bit of flexibility for those who are no longer able to work because of COVID-19. They do have a bit of time to be able to pay that rent, although they still will be responsible for their portion of rent, whatever that is. After the Section 8 housing voucher covers a portion of their rent, the family has to pay the other portion. and they have a little bit of an extension on that. I do believe that that expires in mid-July. This link here will bring you to the HUD website, which will help to get you in contact with the local PHA, who again can provide more information on estimated wait time, as well as the income requirements. Another program I wanted to highlight today is LIHEAP, or the Low Income Energy Assistance Program. You'll notice that the programs are really big on acronyms. So most every program does have a long name with an acronym attached. But LIHEAP is the program that patients and clients can access to assist with their heating and cooling costs, their energy bills, energy crisis assistance, weatherization, and energy-related home repairs. Federal eligibility mandates that states cap LIHEAP eligibility at no more than the greater of 150% of the federal poverty guideline, or 60% of the state median income, and no less than 110% of the federal poverty guideline. So the federal poverty guidelines are, it's a threshold that is put out each year. It changes annually, and it's put out by, oh gosh, I'm not exactly sure which agency puts it out, but it's easily accessible online, and I can definitely link you all to that after today's presentation too. You'll see on this screen, we linked a chart which demonstrates the federal income limits for this year. Although, again, states can pose less strict criteria if they so choose. So thinking back once again to April, we remember that she was a single mom with 2 children, so her household of 3 would have needed to earn less than $31,995 in order to qualify for this assistance. In response to COVID, the CARES Act approved an additional $900 million in support of LIHEAP programs. That additional funding can be used for any purpose normally authorized under federal LIHEAP. So it can expand the program, it keeps the program running, like administrative costs, and can also allow for states to expand the eligibility of who can qualify for LIHEAP. The best way to apply for LIHEAP is to contact the National Energy Assistance Referral Project, or NEAR, and I've provided here their toll-free number. You can also email them. Another way is just to visit your state's LIHEAP office for more information. So moving into food and nutrition, this is a huge concern for so many people now, with children out of school and no longer receiving the meals that they were once provided at school, and just in general with people working less and grocery costs going up. This is another really hot topic that we're hearing a lot about in the news. So the Supplemental Nutrition Assistance Program, or SNAP, is the largest federal nutrition assistance program. SNAP provides benefits to eligible low-income individuals and families through what's called an electronic benefits transfer card, or EBT card. This card works just like a debit card and can be used to purchase eligible food in authorized retail stores. Determining eligibility for SNAP, a household must meet certain bank balance limits. If the household has a member who is elderly, over 60, or disabled, they may have a higher bank balance limit. In addition to those eligibility requirements, the household cannot have over $2,250 in countable resources, such as cash or money in a bank account. If the household has at least one member who is over 60 or disabled, again, that resource limit, just like the income limit, is increased to $3,500. When counting resources to determine eligibility for SNAP, again, it's pretty nuanced, and there are certain resources that are not included in that count. So a person's home or lot, if a person's receiving SSI or TANF, so again, Supplemental Security Income or TANF, their resources are not included because it's assumed that if they're receiving SSI, we've already looked at their resources and they would also meet the eligibility for SNAP. Also to note that most retirement and pension plans do not count as resources when determining eligibility for SNAP. So again, we can use April's story and see that for her family of 3, she'll need to earn less than $2,331 in order to receive SNAP benefits. She'll need to report her income monthly to the USDA, and depending on her monthly income, her benefits may go up or down. So I think we talked a bit about the benefits, but you'll see here, if we do determine that April is eligible for SNAP benefits, the maximum her family will get per month is $509. She can then, like we said, use that money like a debit card at SNAP approved vendors to purchase groceries with some restrictions. There are certain foods and grocery items that you're not able to purchase using your EBT card. And the allotments, again, are based on the number of people in the household as well as the household income. So in response to COVID, the USDA has made several really neat changes to the SNAP program. States have the approval to issue emergency SNAP benefits to households who receive less than the maximum payment. So someone who's previously received maybe 50% of the maximum payment may now be eligible for the full 100%. States also have been given approval to issue EBT cards to households with children who usually would have received free or reduced cost meals at school. So this is called PEBT. And some people attending this webinar may have experienced this program firsthand. So if your child was eligible for any sort of free or reduced cost meal at school, they will automatically receive a EBT card with funding on it, so that during the pandemic, families are better able to access food for their household. The other change that was made due to COVID was that the USDA extended the time limit and reduced the work requirement for able-bodied adults without dependents. So that's working adults without children to be able to receive SNAP benefits. Because not every state is participating in PEBT, I linked here the full list of states who are participating, so you can easily click in there and see if your state or the state of the client you're working with is listed there. And then to apply for SNAP, once again, a state-driven program, I've included the state directory at the bottom. So the final program we're going to go over today is the Special Supplemental Nutrition Program for Women, Infants, and Children, also called WIC. WIC provides federal grants to states for supplemental foods, healthcare referrals, and nutrition education for low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, and to infants and children up to the age of 5 who are found to be at nutritional risk. The federal income standard to receive WIC benefits is between 100% of the federal poverty guideline and cannot be more than 185% of the federal poverty guideline. If a person is found to be eligible for TANF or SNAP, they're automatically income eligible for WIC. However, in addition to the income requirement, applicants must also be seen by a health professional, such as a physician, nurse, or nutritionist, who can determine if the individual and the child is at nutritional risk. In many cases, this is done right at the WIC clinic with no cost to the applicant, However, this information can also be obtained from another health professional, such as a primary care physician or a pediatrician. At a minimum, to meet this nutritional risk requirement, the applicant's height and weight must be measured and their blood work must be taken to check for anemia. So again, the applicant must have at least one of the medical or dietary conditions on the state's list to meet the WIC nutrition risk criteria. Okay. So the benefit that WIC participants receive, WIC participants receive checks or vouchers to purchase specific foods each month that are designed to supplement their diets with specific nutrients. So think of formula or vitamins that are important to a pregnant woman's health. In addition, some states issue their payments through the EBT card. So if you're receiving WIC, if you're receiving SNAP, you can also receive WIC on that same card. However, in the grocery store, you'll find that a family will have to separate out their purchases. So they'll have to pay for WIC purchases through their WIC funds and SNAP purchases through their SNAP funds. Because as I mentioned, WIC is really only for really specific nutritional food and drink items. In response to COVID, the Families First Act provided $500 million to expand WIC through September of 2021. A big change that they've made is to the nutritional needs assessment. So states are able to waive in-person assessments, and they're also able to defer reassessments. So this is a huge change, and obviously one that's most needed in this time of social distancing when folks are not always able to get to the doctor or comfortable going to the doctor and trying to limit their time outside of the home. They're still able to apply for and receive this benefit through the waiver of those in-person assessments. So this funny looking link down here, again, is the state-by-state directory of the full eligibility criteria and application for WIC. So I made a lot of references to different programs today. Here is a slide with all of that information that I hope is helpful to those of you listening on the call today. I just wanted to point out a few key parts of this slide. So you'll see we started with Family Reach policy resources. So this is specific to COVID-19 and changes to policies that were made at the start of the pandemic or throughout the pandemic. We also, as I mentioned at the beginning of this presentation, have a financial handbook that's available for download. It's a free tool specific to cancer patients, but there may also be information that's helpful in there, especially if you're working for somebody with a disability. I think a lot of the information is transferable. We also will be launching a new version of this handbook, and it's really more of a guidebook now, so it's really action oriented and can help your work with your clients, especially around things like budgeting. I also wanted to highlight the Foundation for Financial Planning Volunteer Match website. So you'll see these are all links in here. So you're welcome to click in there and see if there's any volunteer opportunities that you're interested in. And then really quickly, I wanted to go over a really cool and handy resource, and that is the benefits.gov website. And so hopefully you all can still see this screen, but the benefits.gov website is a tool that's available for anyone to help locate the benefits that they may be eligible for. So you can work with your clients, or their clients themselves are able to access this website and locate the different types of benefits that are appropriate for them. So we covered a few different things today, but there's more out there, such as disaster relief, medical assistance, and loan assistance. So I'm just going to show really quickly what that looks like, and then we'll move on to some questions. So you'll see here, it's going to ask some basic information to get a feel for your age. So we'll just kind of go through a bit. They'll want to know your citizenship status, and then again, because so many of the programs are state specific, what state you live in. So you'll see the client can just put different information in here. They'll answer these questions. It kind of starts with the demographics. What's your household income? What's your employment status? Your marriage status. And then it gets into things like, are you disabled? And once you answer those first kind of screener questions, it'll pull up all of the different options. What type of benefits are you looking for? So the family can easily access this website and see what programs they might be available for just based on information that they already know. I think this is just a great resource, and do always recommend when families come to us at Family Reach that they look into this because it is user-friendly, and I think easy to understand. So with that, that's all I have. So I did want to open it up once again, open it up for questions. I would ask that if we have any specific questions really related to a very specific situation, we hold off on that and we can address that offline, just because, like I said, some of the programs can be super nuanced, and I know individual family situations can also be quite nuanced.
Thanks so much, Jackie. We have a question from Robert. He's asking to talk about the benefits available to a parent of a child who has cancer, which is putting major financial pressure on the parent.
Yeah, absolutely. And that is something we see often here. So very often when a child is diagnosed with cancer, regardless of the parent's income, they will, I shouldn't say very often, again, it's state specific, but many states do open up Medicaid, which we didn't really get into here, but that's the health insurance option for low income individuals. So that is definitely something that the family should look into as soon as possible to see if they're eligible. If their state is not one that's expanded Medicaid, they can access a lot of these programs. I would highlight the most important probably being SSI if the parent has lower income or is expecting that, you know, they're no longer going to be able to work because they have to bring their child to treatment. SSI can be a little bit of a help to replace some of that income. There's also, you know, in addition to those government resources, there's a lot of nonprofit support out there for families fighting cancer. Definitely would encourage that family specifically to reach out to Family Reach. We work with pediatric cancer patients and their families every day, and partner with the hospitals where they're being treated to be able to get direct financial support out for those who qualify. One other thing I guess I'll mention since we're on this screen and it's jumping out at me from this question is there is other websites that kind of help families to locate social services. So you'll see here the very last resource is called Aunt Bertha, which yes, is kind of a funny name for a resource, but it's a social service locator kind of similar to the benefits.gov where the family can just input their information and their zip code, and it'll pull up different nonprofit organizations and even maybe some for-profit organizations that the family could benefit from.
Does anyone have any other questions? I encourage you to write it into the chat box and then we'll read it out loud. No?
So I see, and it might be because I'm the presenter, I'm able to see, Tiffany I see a few questions here. Tiffany had a question. about the look-back period for SSI and the resource qualification. So asking, for example, if a person has given away their assets 3 months before applying, will those be considered? And I believe, as I'm saying out loud, the answer to that is no, those assets will not be considered. It's at the moment that you're applying that the Social Security Administration is looking at your assets. Oh, go ahead.
Other questions asked directly to you, Jackie, that I can't see?
I'm not sure. I do see some questions here in the chat box. So somebody else asked if the $2,000 resource limitation includes the stimulus check. I do believe the answer to that is yes. It is a source of income that the family would have. So
actually, Jackie, I did a quick search when that question came in, and the guidance is that that will not count for income for those benefits. But if there's any left over in the after 12 months, it could count as some of the resources. So that's what I found out on a legal services website. So I believe that's the latest. But it was a great question because it's really it is confusing, and this is all new. So
yeah, absolutely. And thank you, John, for correcting me there. I was unaware of that, so that's good to know.
Any other questions? Yeah, Robert's asking if a replay of this webinar will be available. Yes, we will be posting a replay on our website along with the deck. Okay. Well, Jackie, this was very, very helpful, and I think that this resource will be able to be used by all of us now and in the future. And we really appreciate you taking the time to teach all of us about these helpful benefits. Definitely a topic that I know everyone is not familiar with. So thank you very much.
And I echo that, Jackie. Thank you. And I want to thank you, a big thank you to Family Reach for such a terrific partnership, and to FPA as well. Great information today, Jackie, and just thanks again.
Thank you. Thanks again for hosting, and thank you all for joining us today.
Have a great day, everyone.